99% of calcium is found inside the bone. 1% is found outside the bone in the blood, tissues, and cells. In the bone, calcium is a key player of bone health and development. In blood and tissue, calcium is essential for blood clotting and stabilizes blood pressure. It also contributes to normal brain function and is critical for communicating essential information among cells. Intracellularly, calcium helps insulin open cells to glucose. It is needed for the release of chemicals that transmit a signal from a nerve cell to a target cell. It facilitates actual process of contraction of the muscle cell and assists the movement of sperm into egg to fertilize the egg.
The major causes of hypercalcemia.
Hyperparathyroidism, an increase in parathyroid gland function. This condition is usually caused by a benign tumor of the parathyroid gland. This form of hypercalcemia may be present for many years before being noticed.
Cancer. Cancer can cause hypercalcemia when it spreads to the bone and causes the release of calcium from the bone into the blood, or when a cancer produces a hormone similar to PTH, resulting in increased calcium levels.
Tuberculosis and sarcoidosis. Inflammation from tissue injury raising vitamin D in blood levels. The elevated levels stimulate the digestive tract to absorb more calcium, raising the calcium levels.
Prolonged immobilization. Bones that do not bear weight will release calcium into the blood.
Dehydration. When there is less fluid in your body, calcium concentration rises.
Excess vitamin D intake. Eating or drinking too much calcium or vitamin D in your diet raises calcium in blood levels.
Other causes of hypercalcemia may include
hyperthyroidism,
kidney transplant,
HIV,
lung cancer,
breast cancer,
multiple myeloma,
and metabolic disorders.
Medication-related thiazide diuretics.
Taking thiazide diuretics drugs is the most common drug-induced reason for a high calcium level.
And lithium.
May increase the release of parathyroid hormone.
We need more milk! Ben, don't let him get away! Get him! Come on! Go around that corner!
Well, the devil went down to Georgia. He was looking for a soul to steal. He was in a bind because he was way behind. He was willing to make a deal. When he came across this young man sawing on the fiddle and playing it hot, and the devil jumped up on a hickory stump and said, "Boy, let me tell you what. You probably didn't even know it, but I'm a fiddle player
I can
too.
already taste that
And if
sweet
you
milk
care
on
to take
that
it there,
sweet
I'll
milk.
just make a
Get
bet
down
with
here.
you. Now, you played pretty good fiddle, boy, but let's give the devil his due.
6 gallons should be enough, right?
I love Friends.
Me too.
They always have the best ideas.
Come on, you can drink a gallon of milk in 10 seconds?
All right, watch me. Okay, you time me. Ready?
Ready, go.
Hey guys, do you want to do it?
Yeah!
Symptoms experienced with hypercalcemia. People with hypercalcemia may experience the following symptoms:
Loss of appetite,
nausea and vomiting,
constipation and abdominal pain,
increased thirst and frequent urination,
fatigue, weakness, and muscle pain,
changes in mental status including confusion, disorientation, and difficulty thinking,
headaches.
depression.
Severe hypercalcemia may lead to kidney stones, irregular heartbeat, or heart attack. Potential severe side effects of hypercalcemia include loss of consciousness and coma. really have to pee.
I can't go.
Hurry!
Are you doing okay?
Oh, it's just a number 1. It won't take too long.
Okay, you've been in there a while.
The girl's gotta go and she has to go.
Milk was a bad choice.
I don't feel good. I don't want to eat anything.
How about just a donut?
No! No!
What will occur if this balance is left untreated?
Osteoporosis. If your bones continue to release calcium into your blood, you may develop a bone-thinning disease, osteoporosis, which could lead to bone fractures, spinal column curvature, and loss of height. Kidney stones. If your urine contains too much calcium, crystals may form in your kidneys. Over time, the crystals may combine to form kidney stones. Blockage from a stone can lead to kidney damage, and passing a stone can be extremely painful. Kidney failure. Severe hypercalcemia can damage your kidneys, limiting their ability to cleanse the blood and eliminate fluid. If kidney damage is severe, you may lose kidney function permanently, resulting in end-stage renal disease. People with end-stage renal disease require either permanent dialysis or a kidney transplant to survive. Nerve system problems. Because calcium helps regulate your nervous system, severe hypercalcemia can lead to confusion, dementia, and coma, which can be fatal. Abnormal heart rhythm, arrhythmia. Hypercalcemia can affect the electrical impulses that regulate your heartbeat, causing your heart to beat irregularly.
Normal and abnormal calcium levels.
A blood calcium test is ordered to screen for, diagnose, and monitor a range of conditions relating to the bones, heart, nerves, kidneys, and teeth. Blood calcium levels do not directly tell how much calcium is in the bones, but rather how much calcium is circulating in the blood.
PTH and vitamin D are responsible for maintaining calcium concentration in the blood within a narrow range of values.
Normal values for calcium serum ranges from 8.8 to 10.6 milligrams per deciliter.
Critically high serum calcium levels is 14 milligrams per deciliter and above.
Critically low serum calcium ranges from 6 milligrams per deciliter and below.
How is hypercalcemia treated?
Hospital-based treatment.
If you have severe hypercalcemia, you may need to be hospitalized to reduce calcium to a safe level and protect your kidneys and bones. If so, hypercalcemia treatments may include
Intravenous fluids to rehydrate you.
loop diuretic medications, such as furosemide, to help flush excess calcium from your system and keep your kidneys functioning.
Intravenous bisphosphonates, a group of drugs that include pamidronate and zilendronate to prevent bone breakdown.
Calcitonin, a hormone produced by your thyroid gland to reduce bone reabsorption and slow bone loss.
Glucocorticoids, to help counter the effects of too much vitamin D in your blood caused by hypercalcemia.
Hemodialysis or peritoneal dialysis, to help remove excess waste and calcium from your blood if your kidneys are damaged and you don't respond to other treatments.
Home-based treatment.
If your hypercalcemia is mild, you and your doctor may choose to wait and watch, monitoring your bones and kidneys over time to be sure they remain healthy. If you've already lost bone mass or developed kidney stones, your doctor may recommend surgery to remove the affected parathyroid gland or glands, which cures the condition in most cases. If you're not a good candidate for surgery, your doctor may recommend medication. Medications. Sensipar, which has been shown to lower calcium levels in the blood by reducing production of PTH, may be effective for some people with hyperparathyroidism. If you've developed osteoporosis, taking medications called bisphosphonates, such as eledronate, risedronate, or abandronate, may preserve bone mass in your spine and hip, reducing your risk of fractures.
Patient education regarding hypercalcemia.
It may be possible to prevent bone and kidney damage by doing the following.
Drink plenty of fluids, especially water. Drinking fluids can help keep you from dehydration and help prevent kidney stones from forming.
Exercise. Once your calcium levels return to normal, and if you're otherwise healthy, it is important to remain active to help maintain bone density. Try to combine strength training with weight-bearing exercises. Strength training builds muscles and bones in your arms and upper spine. Weight-bearing exercises such as walking mainly affects the bones in your legs, hips, and lower spine. If you're new to exercise, start out slowly and build up gradually. If your hypercalcemia is a result of cancer that has spread to your bones, talk to your doctor before engaging in any exercise. Don't smoke. Smoking has been shown to increase bone loss as well as dramatically increase your risk of a number of serious health problems. Talk to your doctor about the best ways to quit. Avoid or limit excessive exposure to natural or artificial sunlight or any source of vitamin D.
Can we all get in a hot shower and turn on the hot water?
Is intolerant!
I told you shouldn't have done it.
You don't get them girls loose, loose. You don't get the world loose, loose. You don't get money, Mr. Worldwide. But I do, I do. You don't get them girls loose, loose. You don't get the world loose, loose. You don't get money, oof, oof. But I do, I do.
I say y'all having a good time out there.